Hello, welcome to the VR scenario discussion. You have just viewed the first part of Billy's visit to the dentist. In this first portion, there are several aspects of the interaction the dentist can improve upon. Although seemingly minor, it can make a big difference in getting an anxious child to cooperate in a dental setting. When you first greet a child, it may help if you are not wearing your mask. Sometimes it can be a bother to remove the mask in between patients, wash your hands, and put it back on again. However, it can help you look less intimidating and reduce the issue of white coat syndrome. You may also have noticed that the dentist directed most of her questions about Billy to his mother. Many of us can be guilty of that, focusing on the parent whom we expect answers from rather than the patient, who in this case is little Billy. Furthermore, the dentist was multitasking by typing on the computer at the same time. Although time efficient, children notice when you're not paying attention to them. Sometimes, when we try to explain medical terms to children, we inevitably use some technical jargon, like plaque and cavities. To a young child, this may sound foreign, represented in this scenario being obscured by white noise. This can add to the anxiety of a child. Using childrenese or simple terms that a child can understand will help diffuse the fear of not understanding what is going to happen. Careful placement of the parent, which is the source of comfort for the child, can allow the child to see the parent easily throughout the procedure, alleviating anxiety. In the scenario, Billy can only hear his mother, but have to turn all the way back to see her. Sometimes we unintentionally shame the child by saying things like, "You are a big boy, right?" or "the 3-year-old was better behaved," can be counterproductive. Most children like to please. Praising them for things they did well usually build up more confidence than shaming them into doing something. Jumping into potentially scary or unpleasant procedures can be traumatic for a young child. Taking time to explain the procedure and demonstrating it in a non-threatening way before actually proceeding can help a young child accept new experiences. This is also known as tell, show, do. Perhaps explaining to the child before lowering the chair abruptly or proceeding with the cleaning using a noisy machine can help alleviate some of the anxiety the child is feeling on his first visit. There are other minor points like tone of voice and non-verbal communication such as smiling, which is lacking in this first part. Feel free to re-watch the first part and apply what you have learned previously to see if there is anything else you would improve upon. When ready, please proceed on to the second portion of the scenario to see some of the techniques we discussed in action.